Now we are going to start pharmacokinetics. Okay, in the last we were studying about the enzyme kinetics. Now we are going to talk over the pharmacokinetic. In this, we are studying all the impact of drug's ability to achieve the desired results, and pharmacokinetics includes absorption, distribution, metabolism, and excretion. These four things are including the pharmacokinetics to achieve and get the desired result of the drugs. But before we are starting our bioavailability, first I want to discuss about the routes and how the drug can be administered. The drug administration. The drugs can be administered by entry route, beta entry route, and other routes. The entrum includes all the routes that use GI tract and can be used if we give drug oral, sublingual, and also rectal. The parenteral includes IV, IM, and subcutaneous. And the others includes inhalation, intranasal, intrathecal, and topical, like creams and ointments that absorb by the skin. Fine. I am just telling about this all administration because the method of administration of drug affects how much it will be available to the body, and the amount of drug available to the body is called bioavailability. Okay? Secondly, the bioavailability is a fraction of administered drug reaching systematic circulation. And it is suppose we are taking 100 mg or tablet. And from then the 50 mg absorbs and remain unchanged. So bioavailability will be 50%. Okay, but for the IV, knows the bioavailability the 100% because you are injecting the drug directly into the blood system. For the orderly F stand for the bioavailability, typically less than 100 due to incomplete absorption. There are 2 points. Incomplete absorption and the first part, metabolism, and can be calculated from the area under the curve and the plot of plasma concentration over time. In this paragraph, we get the 2 points first for the IV dose. The bioavailability is 100%, and the for oral dose is less than 100 because of 2 points. First, due to incomplete absorption, and second, first part, metabolism. Fine? And what does it mean? Of that, the last line of the curves. Let me elaborate that graph. Suppose this is 0 point, and you are given the IV dose here. As you injected the dose, it will give a peak of this, okay? And with the interval of time, the x-axis is for the time. With gradually time, the dose will decreasing, okay? But for the oral, for example, at this time at 1 o'clock, you guys take 1 tablet. As is given to digestion system and GI tract, slowly it absorb to your body, and it gives a peak point here, and then it will be excreted. Fine? And from this graph, you can find the bioavailability by the area under the curve. Like, that is the graph, and it's the curve, this area between bioavailability. Okay, and for that, to give that formula, the bioavailability is equal to 800 of the oral multiplied by dose of IV, and dose of oral multiplied by 800 of the intravenous drug, and we have to divide that. Fine. Simply, I again summarize the bioavailability that it is the amount of drug that is available in the body after the administration, and in the IV dose. In the IV dose, it's the 100%, and for the orally, it's typically less than 100%. Don't viewers joking about the first pass metabolism. Let me explain, because when you guys take any drug orally, that drug is absorbed by the liver. And some drugs are rapidly metabolized in the first pass that liver having some zones first, second, and a third. In the third zone, there's a cytochrome for 15 times that will metabolize that drug, and during this drug there's some two phases of the conversion in which the drug will become polar ionized or metabolized by the liver and excreted from the body. Okay? So with some of drugs that rapidly metabolize in the first path, and their amount will be decreased that reduces circulation, and which can be reduced in liver disease patient, because you guys know the first one metabolism means alkaline in the liver. If some patient having the liver disease, the liver is not working good. So drug is going to the liver and facing some metabolizes or the reactions. If it will not face any reaction, and in this reaction and dharma will be decreased, and our amount will be increased in the body. So the one of the Planck statement, the first pass metabolism can be reduced in the liver patients.